Sleep apnea isn't just about your lungs, it's about what's happening in your neck. When you sleep, loose tissue or extra fat in the neck can collapse into your airway. That blockage is what causes snoring, choking, and breathing pauses. The good news? There are evidence-based ways to manage neck tissue and open your airway, even without a CPAP mask. Here's what actually helps targeted neck and throat exercises improve muscle tone and airflow. Myofunctional therapy, specific tongue and mouth exercises, can reduce apnea severity by tightening loose tissues. Singing or playing wind instruments strengthens the muscles around your airway. Yes, even music helps. Weight loss lowers fat deposits around the neck, directly reducing airway collapse. Side sleeping prevents the tongue and neck tissues from falling backward and blocking airflow. For some patients, medical devices or procedures can help by stimulating airway muscles or increasing space in the throat without wearing a mask. When the airway stays open, sleep improves, oxygen levels stabilize, and energy, focus, and heart health all get better. If you snore, wake up tired, or can't tolerate CPAP, visit medicalwellnessdoc.com to book an appointment with Dr. Nisha Kuruvadi.